Hey guys, this is Nicola from WeWag Toronto, and today we are going live with Dr. Taron Carruthers. She's a chiropractor. She's also a certified COAC animal chiropractor, and she's co-owner of the Dog Joints and the Stockyards Chiropractic Clinic, which is a clinic for people and for pets to go and get chiropractic treatments. I don't know about you guys, but I know absolutely nothing about chiropractic treatments for dogs or for animals. So I'm super excited to chat here with Taron and to hopefully learn a little bit more. I hope you guys learn a little bit. And sorry, my dog. And if you have any questions, please just jump in and ask any questions. All right, we're gonna bring Taron on.
Hi.
Hi, how are you?
How are you, Nicola?
Good, good. It's funny, I start talking and then my dog starts pawing at the crate, of course. Hopefully everybody heard. So yeah, you're doing good?
Surviving. Thriving in isolation, I guess, as best as you can.
Yeah. Tough times for sure. Cool, well thank you so much for joining us today.
Yeah.
I'm having a hard time hearing you. Is there any way to turn the volume up?
I think it's already up.
Oh, that's better.
Is that better?
Yeah, that's better.
Okay.
Awesome. Yeah, so I was just saying, I don't know anything about chiropractic treatments for dogs or for animals. So I'm really excited to be sitting here with you.
Yeah, awesome. Most people honestly don't know it's a thing, so this is a good platform to educate the masses.
Absolutely. So how did you come across your journey to working with dogs and animals?
Like from an animal chiropractic perspective. So you either have to be a human chiropractor or a veterinarian first before you can become an animal chiropractor. I'm a human chiropractor first and foremost. My first exposure to animal chiropractic was in university. So I grew up riding. Can you hear me okay?
Yeah, I just turned my volume up. I think my volume was down a bit.
Okay. So I grew up riding horses. I had a horse with me in university, and he was an older horse, had back pain and recurrent bouts of lameness. So I had a vet out to have a look at him, and this vet was certified in chiropractic as well. And he decided to approach it from a chiropractic perspective versus a traditional medical perspective. And this vet fixed my horse in like 3 visits without any medication, which I was like blown away by.
Right. Yeah.
That kind of like led me on a mission. So that was my inspiration for that. Pretty cool.
Yeah.
That and I'm just an animal lover in general. So.
Right.
Yeah.
Awesome. Cool. And then how did you come together putting your place together? Was that something that you decided you wanted to do after you decided that you wanted to do chiropractic work, or like how did the whole entrepreneurial journey begin? How did you get to where you are?
Yeah, so I have 2 sort of different things on the go. I have a mobile-based practice that's mostly in Northern Ontario. I'm from Muskoka originally, so I have put a lot of barns in Muskoka, North Bay. I even go up to Timmins, Sudbury, Manitoulin, that sort of thing for farm calls mostly. And then my business partner and I, Dr. Craig Landry, we went to school together, and he reached out to me a few years ago about the possibility of opening a practice with him in the GTA, and that kind of just blossomed from there.
Amazing. And that's in the West End. So for anybody who doesn't know, it's in the West End of Toronto.
Yeah.
Cool.
Stockyards.
Cool. So how does somebody know that their dog should come in for chiropractic treatments? Like, what are some telltale signs, or should this be something that people do regularly for maintenance, and kind of like what are the differences?
My dog just ran in here. So with dogs, what you'll notice if they're in pain is a change. Sorry, he's got the zoomies. Is a change.
What's that?
My dog has the zoomies right now. It's running around. It's a change in behavior. So their energy is flat, won't have the same passion for walks, can't do the stairs, they're lethargic, Sometimes they'll even be off their food or they'll hide from the owner. And then more obvious things like lameness, limping, crying or yelping when you put on the collar or harness, those sorts of things. Even things like hot spots. A lot of people think that's just a issue, but if it's not an allergy that's been ruled out, it can actually be referral from the spine, kind of like a sciatica in people, that horrible burning pain like back of the leg. So dogs can get that too, and it's an altered sensation. It's either numbness or tingling or pain that's going down the limb from the spine, and they'll look at it and just go at it incessantly because they don't know what else to do with that sort of information that's going through their nervous system. So stuff like that.
Cool. And do you guys do x-rays, or is that something that the vet does? And do you see a dog without having a vet treatment first, or do they normally come from the vet and referred? What's the process normally?
Yeah, good question. So I can order x-rays for my human patients. I'm not allowed to order them for the side of things. We don't require x-rays. It's not on the first visit. It's helpful to see them if the dog's already but no, we don't personally take them. We refer back to the vet if we feel that they're necessary. With regards to coming in the first time, owners don't referral from their vet to take their dog to any animal chiropractor. We work closely and co-manage with that throughout the PA. Specifically, if the dog needs treatment or the acupuncture or laser, in addition to what we're doing, but you don't have to go through your vet to come and see us for the first visit.
What age would you recommend coming in for chiropractic treatments for dogs? If they're just coming in for maintenance and sort of checkups, like how often and what age would you recommend?
Honestly, it depends on the case. Like I've adjusted newborn puppies, traumatic birth. My oldest patient who recently passed away was an 18-year-old Labrador Retriever. It's just a spectrum. It depends what's going on with the dog. Depends what their job is. We treat service dogs, just run-of-the-mill pets. Just depends on what's going on. There's no really rule for when to bring them in. Individual.
Awesome. And what's the percentage that you see normally of cases of serious injury to more maintenance kind of stuff? Like what's the different percentages, do you think?
So I would say for our canine practice, the majority are maintenance. We see a lot of senior dogs, so geriatric dogs who are stiff, maybe arthritis, some hind end issues. I would say probably 7% are more of a maintenance based, and then are more acute. A lot of our will
for maintenance. How often are those dogs normally coming in?
That's also another. It's very individual and case.
Yeah. Probably a tough question.
No, it's okay. What we do at the dog joint is typically recommend a trial of care that's 2 treatments a week for 2 weeks, and then we'll kind of reassess on that. The dog.
I'm gonna let him out of the phrase. Sorry.
No. If the dog is always handsome, if the dog joint treatment by that 4th visit, what we'll typically do is slowly decrease the frequency. So maybe do a supportive treatment from then, and then if they keep improving, spread it out with the goal being for most average dogs, like a maintenance care every 2 to 3 months.
Yeah. How long does it usually take for dogs to see? Does that depend too on a per case by case process, or
to see improvement?
Yeah.
Again, it's super variable, but some dogs respond immediately. Some dogs take a little bit more time and more of a structured treatment plan spread out over weeks. And some dogs respond at all, which does happen. And if that does happen, then we refer back to the vet for more testing. But usually, honestly, dogs respond faster than people. One case comes to mind. A small breed dog came in a couple months ago, but was very roached up through the back, which is a big indicator that there's back pain going on. Hadn't been able to shake off for, I think, 5 days, and was really out of sorts. adjusted the dog, put it back on the floor. It shook off like crazy, and then got the zoomies right in front of us. So that was a pretty immediate response.
Yeah.
One of the things that owners tell me really that happens quick is the dog's energy is a bit better. So they feel a bit better. They're a bit perkier. They're a bit more back to themselves. But yeah, it depends on the dog.
Yeah, that's awesome. It's definitely something that I'm really interested in exploring with mine. So I have a 10-year-old female, and she's like really slowed down recently, you know? So and it just seems like snap of the fingers, all of a sudden she's just really, really slowed down. So I'd be curious to see, like, I'd love to bring her in, you know, when this is all done and have some treatments and see if we can help her get her, like, zoom back a bit.
No, it's not fair. They age so much quicker than we do. And I find that they age gracefully. With those double digits. It's for large breed dogs anyways.
Yeah. I literally was walking her like 90 minutes a day, and then it's like all of a sudden she's just showing her age, you know, so it's hard to watch, right? So, yeah. If you can, like, what are some major things that you've learned from working with dogs? What have they taught you that you would want to share with us?
One would be patience. Treating animals is very different. Animals don't always cooperate. Dogs can be very wicked and very excited. So just be patient and adapting what you're going to do. And just kind of working with what they're doing. Every day is different. Some dogs are really easygoing, and some dogs are cuckoo bananas. So, being patient would be one. Another would be that dogs are very stoic. Dogs can be in a lot of pain and from their owners. For instance, like X-ray dogs who have catastrophic arthritis throughout their spine, their hips and their knees, and they're still just happy campers, wagging their tails and get fired up to go for walks and exercise. And I don't have any arthritis that I know of, and I can't even get motivated to go for a run right now. So they're very stoic. They hide their pain very well.
Yeah. Yeah, that's actually true. My female, she's been limping a lot, and I brought her to the vet actually to be like, hey, like, what's going on with her? And watch her walk. So, you know, I'm walking with her down the hallway, like trying to show them the limp, and she's like literally walking like with no pain. She's all of a sudden walking like perfectly, and I'm like, no, she's really limping, I swear. And they're like, So it's funny, yeah. But again, just like hiding the pain, right? So yeah, I mean, that makes sense. I didn't really think about it, but probably some dogs, it's hard to give them, you know, treatment because they're like maybe all over the place. Or have you always been able to work it out, or has there been any case where like you couldn't treat them?
There's maybe one instance when a dog is very aggressive. I do have muzzles on hand for situations like that. Most of the time, there's no muzzle required. The dogs are happy there. They feel better when they leave. They get a lot of lick treats when they're in the office.
Yeah.
It's usually a really pleasant experience for them. There was one instance when I had an aggressive dog, and even with a muzzle, it was still a bit of a safety issue, but I don't, no, I've never had to like not proceed, I guess.
Yeah, probably just like you said, patience, right? So
yeah, exactly.
Working through it. Cool. And you guys, are you treating serious cases right now, or with everything going on, or is it totally shut down?
So in Ontario, chiropractors are currently allowed to see acute or emergency cases.
Yes.
I'm not in the city right now. My parents live in Muskoka, and I figured it was a better place to be instead of my 700 square foot apartment. So I'm actually not in the city. I'm not practicing right now. My business partner is Dr. Craig Landry is seeing emergency cases at the office. So I think 3 days a week.
Awesome. For when there's emergencies. Cool.
Yeah.
Well, I would definitely love to come in and see you with my elder dog, Lila.
Yeah, for sure. Hopefully this doesn't go on for too much longer and we can make it happen.
Yeah, I know. I think everyone's like, you know, raring to get back to work, right? So.
I know, yeah. Sure.
Cool. Well, amazing. Thank you so much.
Thank you for having me.
Yeah, for sure. I look forward to seeing you when all this is done in person.
For sure. Yeah, keep in touch and we'll work something out for your girl.
Amazing. Okay, thanks so much, Taron.
Bye, Nicola.
Okay, bye.